сколиоза у пациента с несовершенным остеогенезом, Aaron Zhu, Гонконг, Китай.
Thank you, Chairman. Thanks to the organizing committee for the invitation to give a presentation on the BRICS. So this is Aaron Zhu from the University of Hong Kong, China. So actually, this is the second time for me to attend the BRICS. So, but it's a pity and a shame that because of the pandemics, so I cannot join the conference face to face and to meet all the old friends and for the detailed discussion. And today I would like to talk about the osteogenesis imperfect. So actually, this is a rare disease. I would like to say it's one out of the 15 or 20,000 of young populations. So it was known that it's an inherited genetic problem, inherited connective tissue disease. With the advance of the basic science, we know that, but it have different phenotypes. Although the presentation may be also various because of the different gene mutations. So it varies. Although it's only have one name, osteogenesis imperfect, but have different forms. With the worst forms, the patient may die at an earlier perinatal period. Some mild forms may just the main manifestation, only the premature osteoporosis. Okay, so it also varies about the incidence of the scoliosis in this group of the patient. From the literature, so it can be go far away to the 60 or 70 years ago. That varies from 20% to nearly 80%. So. And clinical classification, there are main 4 types, type 1, 2, 3, 4. The type 1 is very mild, as I mentioned. Type 2 is very devastating. So the patient may die at an early age. So you will not see in your clinical in the hospital. So most common one is type 3. And type 4 is just in between type 1 and type 2, between mild and severe. So there is another type of the classification, but it's mainly based on the genetic test. So there are more than 20 different types, but the presentation may be similar. So this is a literature review, talk about the different types and their incidence. Okay. And our experience that there are nearly 80% of the patient with osteogenesis will present with a scoliosis. So it's a huge amount of the patient in this specific populations. So main presentation would be with a deformity progress, the patient will have the collapsed trunk, has a trunk lifting, and most of the patients are not ambulatory. So they're wheelchair banded. So they will present with severe back pain. And if the corpse angle deteriorates to more than 90 to 100 degree, there may be some problem with the cardiopulmonary function. I will talk. So I would like to introduce this disease and our treatment case by case. So for sure, the first presentation for the patient would be the kind of osteoporosis and multiple fracture of the 4 limbs, so there you can see a lot of deformities. So this is, but nowadays we have some treatment like bisphosphonate for the anti-osteoporotic treatment to increase the bone mineral density. This is an example. The patient bone mineral density increased from minus 1 to minus 2.4 to minus 1. So this is the natural history of the patient with like more than 5 years follow-ups. The patient presented with a straight spine, but with the patient become older, you can see the lower limb got the fracture, and we put the intramedullary nails to correct the deformity and the fracture. And as well, the patient also present with a mild scoliosis and slowly progress. So this is a WNT1 mutations, is a type 15. So we can call it mild because the curve progress not obvious. So this type of patient, we can try the progress, as you can see on the slide. Yeah, but unfortunately, probably the breast treatment is not as effective as in the AIS group, because why? The patient have the very poor bone quality. You can see that the minus patient with -4, -3. So very easy to have the ribs. If the pressure is too high, the patient may easily have a fracture of the rib cage and the rib deformities. So the force cannot be transmitted from the breast to the spine, to the ribs, to the spine. So the correction effect is not that good. So most of the patients, the outcome is not that good. So this is another patient, 16 years old, female, and bone mineral density is not that bad, but you can see very severe lower limb problem and the pelvic tilt. So the curve keep progress. The bone mineral density is not that bad. So we did this type of patients. The correction is not that bad, not that difficult, but this is a mild type of B. And this is another case with also more than 5 years follow-up. The curve type, this type is totally different from the AIS we can know, because the apex, in terms of the apex of the lumbar curve, because most of the AIS patients, the apex will be kind of L1, L2, but this one is very low. And as well with the pelvic twisting and the tilting. So the patient have a very severe back pain. So the objective of the surgery would be kind of to level up the pelvics so that the patient can sit comfortably on the wheelchairs. And you can see the correction after the surgery. This is another case. And during the treatment, we also give the anti-osteoporotic chain treatment, so you can see the dramatic improvement of the bone minerals. So this is very good for the anchorage of the pedicle screws, just in case the patient have any implant failure. So this is our study and on the different types of the osteogenesis imperfecta with the bisphosphonate treatment. Although that this kind of medical treatment cannot improve any scoliosis, but it's very good for our corrective surgery in terms of the implant failure, other complications. So this is another type 12 and BMP mutations, mild curve. And the correction is not that challenge, but there is another type, just as I mentioned, type 3, the curve will rapidly progress and to 80 or 100 degree, and the pulmonary and the cardio function will be compromised with the disease progress. So this is one severe case. You can see beside the scoliosis, there's also wedge-shaped and big rotation of the lumbar curves. So the patient will present with a very severe back pain. So it's very indicated for the surgery. And this is a CT scanning. So because it's have a thoracic curve and a lumbar curve, so we performed a long construct fusion for this patient. So this is a case for the rapid progress. It's a worst type. So you can see the curve progress from the nearly 40 degree to nearly 100 degree only in less than 1 year time. So for this type of curve, we need a traction, we need a pre-op preparations, and then posterior navigations will insert as pedicle screws because of very severe rotation because of deformity of the pedicles. Not easy to insert one. So this is a dramatic change before and after the surgery. Another type. So this patient you can see the thoracic trunk is very collapsed. So the patient will present with some respiratory dysfunctions as well, and the trunk collapse. So you can see the rib cage already sit on the pelvis. So the indication for the surgery will to straighten up the spine and lift up enlarge the space between the thoracic cage and the iliac crest. And don't forget that to assess the upper cervical and occipital-cervical junctions. But some of the patients may present with syringomelia and some kind of dense deformities on the C1-2 deformities on the upper cervical junctional region. So this is our treatment of we all the way go down because the curve is so big and the collapse, the trunk shift. So we perform go all the way down to the pelvis to lift up the patient. This is another one. You can see the very severe rotation and the deformed, very osteoporotic. You can see from the even from the X-ray. And the deformed loading. Actually, the patient, all these patients are not ambulatory. They sit on the wheelchair, but the aim of the surgery is that the patient can sit comfortably on the chairs. This is before the surgery. Before the surgery, because of deformities, her two arms is not independent. Has use the arms to support herself. So after surgery, we stretch out the spine so the patient can free their hands. Yeah, this is another case of the very severe curves. So you can see that the scoliosis in OI varies from very mild one, very which is mimic to the AIS patient, and to very severe, weird, bizarre one. So you can see from the CT scans. And one thing is we should be careful about this patient that for this kind of big curve, if it's an AIS patient, we can very comfortably to put on the harrow traction. But don't forget that even the skulls, the bones are very fragile. So this is a complication that when we put on the harrow, there is some fractures of the skull bones. So you should be careful when you want to put the patient on the traction. So this is the surgical outcomes. You can see that we try to insert as many as we can the pedicle screws just to increase the density of the implants because of the osteoporosis, the power of each pedicle screws is not as strong as in normal bones. So this is very important. This is a comparison between before and after the surgery. Another case. So this one is a little bit bizarre. Although we use navigation, sometimes we cannot insert the pedicle screws. Why? Because this version we only can fix the lumbar spine. We have to give up the thoracic spine. We can see that it's very uncommon. You can see the congenital changes on the lumbar spine. Okay, and this is 3D printing of this patient. Very unusual. So pre-operative proper assessment is very important for this time of the patient. You can see why we cannot insert any implants in the thoracic spine. You can see the vertebral body is already synced, and all the trajectory of the pedicle screw is blocked by the rib cage. So we cannot insert any pedicles at that levels, T6 to 7. Okay. So as I mentioned, this patient may be combined with some basilar invaginations, some other congenital deformities. So you can see the hydrocephalus and the basilar invaginations. So pre-op, don't forget to do the CAT scan on your brain and upper cervical spine. This is our. So this patient as well, we put on the traction. For sure, that with the traction we can increase a certain percentage of the corrections and make our on the surgery and the correction on the table much easier. So the treatment for OI type 1 is quite mild, but type 3 and type 3 especially will become very vicious. So we should be very careful about this type of patient that very rapid progress and become very severe one and compromise our cardiopulmonary functions. So you can put a patient on the skull harrow traction, but be careful about the skull fracture. And the osteoporosis and the rib cage deformities is a big challenge to our corrective surgery. Don't forget the C1-2 and occipital deformities in this type of patient. So this is the end of my presentation. Welcome to our hospital, which is based in Shenzhen and close to Hong Kong. And hope see you all guys soon and welcome any questions. Thank you.